Hi everyone. Julian, welcome to Report Out. Could I just request, could you turn your mics off if you've got them on at the moment? I'm just picking up a bit of background noise. Great. We've got an update on the vaccination programme. Fantastic programme this. So looking forward to hearing about latest developments, and over to the team. Thank you.
Thanks, Julian. Hello, my name's Sophie. I'm a KPO specialist who's been seconded into the vaccination programme at Elland Road as the operational improvement lead. And we're going to be talking about the improvement work that's been going on at Elland Road over the last 4 weeks. So, as we were saying, over the last, since Elland Road opened and Thackray have opened, we've been using the Leeds improvement method to do PDSAs and little cycles of change to keep a streamlined service for our patients and staff. Could I have the next slide, please? So, in the Leeds improvement method, we use timed observations to understand the patient journey from the point in which they arrive at Elland Road entrance through to leaving the centre. And the median time for this at the minute, the median average is 8 minutes 27 seconds. So very swift. However, we still recognise there are bottlenecks at the consent process, and that is filling in the paper consent forms and then a medic assessing them at the consent booths or the assessment desks. And we're exploring ways to mitigate this going forwards. Next slide, please. We have recently surveyed over 100 staff members who have been either working in the vaccination centres at Thackray or Elland Road, whether they've done one shift or they continue to work there. And we asked them some specific questions about what they'd like in their induction packs and how they could be better set up for their shift. We also asked them to pick from words that that staff had offered up for themes to do with a mission statement to try and set up a vaccination programme mission statement. And this is the output. So the themes were all gathered, and our mission is to be the most efficient vaccination centre and keep our communities safe. And we will do this by streamlining all aspects of the vaccination programme and continually improving together. It's all about teamwork. I'll now hand you over to Sarah, who's going to talk to you about our clinical education programme. Next slide, please.
Hello, my name is Sarah Endicott. I'm clinical educator with Outpatient CSU. I'm currently seconded onto the COVID vaccination programme as clinical educator. I came on board in January, and there hadn't really been a lot put in then, and it'd been mainly run by our registered professionals. We'd had some healthcare involvement, and I knew that there was a unregistered workforce that were due to come in, and in conjunction sort of talking to Penny, one of our lead nurses, we knew that we'd need to do some competency assessing and checking. And what was really important, that we needed to let our registered nurses go back to their main jobs as well, because we were relying on overtime, and we were also relying on sort of that goodwill, and it's not always as effective to get those, having those skills in the right place. So we developed a training pod model. What had happened previously with the Leeds Health and Care Academy had worked in conjunction with the University of Leeds and Leeds Beckett University to provide e-learning from Health Education England, and made sure that people had done all the prerequisite learning. From that, we're kind of like the final part of the jigsaw as they reach the vaccination centre. And the training pod model that we designed was really just to help them settle into work, and also to just fill any gaps that they might not have had, but also working within national guidance for training for COVID-19 vaccination delivery. Next slide, please. So the model that we set up was really, I've called it simulation, shadow and supervise. Essentially what this involves was assuming and making sure and doing those checks that all the e-learning had been completed. There is an element of some face-to-face training that is needed, and we were doing that sort of by simulation. And then the next step of that was to allow them to shadow in pods and then undertake some supervised practice. The essential and fundamental component for this was safety on citizens. We had to make sure that our staff were absolutely competent and safe to actually inject our citizens, and we wanted those to make sure that they are safe. So and we've had some really good feedback about the sessions. So we've had physiotherapists, I've had dietitians, veterinary nurses, cabin crew, beauticians, pilots, osteopaths. The staff we're getting, as well as our healthcare professionals from lots of different backgrounds, it's been amazing to train them all. And as you can see, just from some of that feedback from one of the physiotherapists who's been in the NHS, absolutely loved the training. She's been in the NHS 40 years and gave us some lovely, lovely feedback. And initially what we'd done for our training pod was we wanted to get as many people through. We knew there was a bottleneck of staff waiting from workforce to come through for this training. There was a big student pipeline, and there was also an NHS professionals pipeline and other organisations that we've been working collaboratively with. So we set up some 4-hour sessions, but these weren't quite long enough. So by doing a PDSA cycle, next slide please, we looked at sort of the length of sessions, and what was more important than getting the quantity of staff through was really the quality and safety of the practice of people. We found with the 4-hour sessions that people were having to come back and repeat that some of that time, and that wasn't great for the workforce. So really to try and reduce that repetition, we lengthened the sessions and had sort of a crossover, and it still kind of wasn't really sustainable. And we've gone from sort of the 4-hour session to doing a full day, and we've incorporated like a local induction and orientation into it as well. So, and what we were finding is from the day session, we are signing off as competent vaccinators. I would probably say 90%, 99% of people coming through those pods on a daily basis. There's just 1 or 2 now who maybe don't quite get signed off because they want to come back for another session. So extending that day was the right thing to do. What we've also looked at in the PDSA cycles is reducing some of our paperwork. So where we've got national competencies to follow, which is really good for transferable skills because it's a National Public Health England document as the final sign-off, we created some local paperwork to measure the competency of our unregistered vaccinators, and that was in line with national guidance as well from the NHS England and Health Education England. This started off as sort of 3-4 pages that they were taking into the pods, and the nurses were having to sign and tick off boxes, and we've managed to reduce that down from 3 pages to 1 page for one document, and then we've reduced a lot of the other paperwork as well. And we've then gone on to now starting to store it electronically rather than just photocopying. And these PDSAs are ongoing. Next slide, please. So looking at the dates, just a little bit of data really. So our training pod opened from the 15th of March, kind of officially. We'd had a few people that I'd trained sort of through that, and I'd got to grips with it. So between 15th of March and the 15th of February and the 22nd of March, we had 162 staff come through our training pod. That was a mixture of registered staff, unregistered staff, and out of that 162, we managed to deem 97.5% competent. And out of that, 131 were the Band 3 vaccinator workforce. And they are now coming in and doing rostered shifts for us. Next slide, please. So Some of the barriers and challenges we've come across are the social distancing during training. It's difficult to do simulation training, and we have our guidance to follow. It's not like it used to be, and I'm kind of working through that now and looking at different ways using the PDSA cycle about how we can overcome this. We've got different numbers, we've got lots of staff coming through different sort of processes, and it's and our staff resources initially were quite thin. I was sort of working on my own, and I've now got a couple of people who are helping me, so that's been really encouraging, and we're still getting very good feedback on the training. So the volume of staff that we're getting through the different pipelines were also a big challenge, and what we've managed to do is work more closely with our workforce peers in human resources to try and align that. And just moving on to the last slide, so next slide please. So the next steps moving on from this will be really to work more closely with our human resources, and we're going to look at reducing the number of training days, because we are currently training over 5 days, but that's been to get the bottleneck of staff through. We realise there will be a steady trickle of staff to maintain turnover, and as lockdown lifts, as people return to their own roles, so our cabin crew may return back to Virgin and Jet2, places like that, other students will return to university, so we'll need to sort of maintain that workforce. By doing that, I hope to create an education and training folder with some SOPs that people can just look at and put some teaching plans in there. And I'm going to be scoping about doing videos and to see if we can sort of reduce the teaching time as well, but still make it really good quality. One of the next steps as well is just to audit our practice to make sure that those people that have come through this training pod are actually maintaining those standards of competence, and we will just then record that, a bit like what we do with our ward metrics within the hospital. And just to celebrate our success really is we've got other vaccination centres of similar sizes asking to visit and observe our training methods, which is really good. It's been a pleasure to sort of work with the programme, and I'm now going to pass you over to Adam Powell from Workforce.
Thanks, Sarah. Yeah, my name's Adam and I'm a Senior Medical Deployment Officer, and I've been seconded to the Vaccination Centre as an Assistant Vaccination Deployment Manager. And part of this really is about establishing and cementing that vaccination workforce. And going through this process, we've obviously had some of those sort of bumps in the road and struggling with being more reactive as opposed to proactive in our work. And I think we all like to kind of stay one step ahead of the game, and we've kind of realised that within this particular centre and set of circumstances that we're all in, it's not always possible to be as ahead as we'd like to. So as we've kind of done these PDSA cycles, as you can see on the screen, we've introduced different ways of conducting more robust production boards using Trello, so we can navigate a lot easier. Things are there, clear and laid out for everyone to see, especially for those that might not particularly be in our immediate team. We can share with wider people if they ever need to see what we're up to and what challenges we're facing, as well as giving more structured conversations and more structured advice when going through certain demands and topics that we are discussing. And one of the big things as well is obviously the demand that we have at the vaccination centre, and with the standing up and standing down of pods, and making sure that we are managing those expectations and that we're actively going out for our demand rather than waiting for people to come to us. We need to go and make sure we're doing everything we can to fill the demand and make sure we can get this vaccination programme to the best that it can be. And using like the Jamboards, like what the post-its are on screen, we've been able to really sort of spotlight different issues that we are having and unpick the areas of potential waste and how it is that we can improve. And we've done this as a big team, including senior management as well, just to see where we can help improve and make sure it's the best vaccination centre. We've understood that part of the workload demands that we are doing as a team was becoming quite unsustainable due to the actual volume. And in particular, it's referencing the staff's health and well-being, and not just my staff, but the staff of the people that we are booking in and getting into the centre. And I think it's just that we need to make sure that we're keeping at the forefront the staff's health and well-being, and making sure that we can produce such a productive and ultimately enjoyable service for both the staff and the patients coming through. And as we started to sort of expose these problems to sort of the wider circles, it's really positive and really great to hear that we are being heard, and we've had these steps now put in place to get these extra resources to come and help the teams and only build and make it better and produce a more streamlined and lean way of working. But yeah, thank you, and I'll pass you over to Katie to talk about pharmacy.
Thanks, Adam. Hi, my name's Katie Houseman. I'm lead pharmacy technician for the vaccine programme. I'm just going to talk to you about the production boards that we've introduced across the vaccination centres. So this is the production board we have at Elland Road. We use this for the pharmacy workforce, which consists of a collaboration across Leeds, actually. So we don't just have LTHT staff who are manning the pharmacy area in the vaccination centres. This is contributed to by LCH, by LYPFT, our GP Confederation colleagues, and also our CCG colleagues. So we needed a central place where everyone could understand what was happening in the pharmacy area, hence putting in the production boards. So the information on there is really easy to digest, it's really concise, and we use it to update the teams on a daily basis. We also use it as a prompt for our twice daily huddles, which is the start of our morning and our afternoon sessions. We've been really clear that whilst LTHT staff have predominantly implemented it, it's a board for everybody, so everyone can contribute to this. They can add ideas as to how we can work better, how we can raise questions amongst the team and discussion points, any issues that people have come across on a daily basis. And also we can use it to request equipment and record our sort of daily sit rep information. Next slide, please. This has been really successful at Elland Road and welcomed by the staff. So we've actually rolled it out at Thackray as well. We have more LTH colleagues at Thackray, but actually the board serves a really good purpose in prompting those huddle discussions as well as providing key data for the day. Next slide, please. We've tried to encourage pharmacy staff to join the main vaccination centre huddles. So we didn't do that initially, and I think we were missing a bit of a trick there. So we encourage our staff to go and join the morning huddle, which is at Elland Road is a really large huddle, especially now that we have so many staff on board. And that allows us to get involved in the discussions. We have joined up briefings then rather than separate briefings in pharmacy. And we also have a pharmacy slot within the huddle, which allows us to brief that broader team on any changes in terms of the vaccine supply, any changes for that day. And we can also contribute with any amendments we've made to the documentation that we're using. So it's a really useful thing for our pharmacy workforce to do to get involved. So filing and reconciliation. So this was a bit of a defect that we picked up within the team because we were finding that because we have such a broad range of staff, people were interpreting what is waste very differently, which we hadn't anticipated. So when we talk about waste, which is something we have to report daily on our sit rep, we're talking about waste as being vaccine that is a short measure, so a syringe that was a short measure, a syringe that we might have dropped on the floor, where we've got a bent needle, so we can't give it. And waste is not where we got less out of the vial than we should have done. So for instance, for a 10-dose vial, if we got 10 doses out, that's absolutely fine. If we get less out, then that's waste. but people were interpreting this very differently. So we've put a prompt sheet for people so that they can understand what is waste, what isn't waste, and that's improved the consistency of our SITREP report and also the consistency of our of how we file our documents at the end of the day and do our reconciliation. Now I'll hand over to Jimmy. Thank you.
Okay. Hi, I'm Jimmy Law, admin support officer in KPO team. I'm currently studying Lean for Leaders, and my Lean for Leaders project is 5S, the storeroom in Thackray Vaccination Center. We recently have applied the 5S work we have done in Thackray to Elland Road. In Elland Road, we sort the equipment and supply in the storeroom. We then separate the excessive items and return to the supplier. We group the most frequent use items and place them on the same shelves where they are easily to be reached. And those frequent use items have a part level, and we have used some visual control such as Kanban to monitor the stock level. So people will know how many they will need to place for ordering. We have also added an ordering list to the door. Staff can easily know who, when, and in what quantity they will need to order next time. This has reduced the duplication. We are now building a standard work process, and hopefully it helps us to maintain a standard. So now I pass time to Suzanne for patient feedback.
Hi, I'm Suzanne Slater. I'm part of the quality improvement team at LCH, currently working at Elland Road supporting the improvement with LTH colleagues. So I'm just going to give a little bit of explain some of the patient feedback that we've received. This is just a snapshot from experience or feedback from last week. So as you can see, the top left hand table is showing people's overall experience of the service, and the majority, well, 98% are actually highlighting it as good or very good. There was a couple of poor noted feedback. However, one of these, when I looked into this a little bit further, they'd actually provided some very positive narrative feedback, so whether that was a bit of an error of selecting the grading. On the right hand side, this relates to how patients feel as they're coming through the centre from a safety point of view, so social distancing and hand sanitising, and as you can see, this is over 99% positive. And the bottom table relates to how they're finding the booking experience, and that's around 98%, but there was a couple of negative and neutral experiences there. Next slide, please. So these are just a few extracts of positive and negative experiences from a narrative feedback point of view. So themes that are coming through. From a positive, it was how friendly staff were, how well organised and how efficient and effective the service is. From a less positive or more of a negative themes, they were around the challenges and frustrations of the national booking system. And there was a couple who mentioned around social distancing, and that was particularly when it was busy times, so lack of social distancing that they found challenging. Right, I'm going to hand over to Sophie. Next slide, please. Thanks, Suzanne. So over the last week, we've done the usual staff surveys, and we had 68 respondents this time across admin staff, marshals, nursing, pharmacy, and at Elland Road, and the workforce team too. And actually, over the 3 questions, how do you feel about your shift today in the Leeds Vaccination Centre? 87% are giving positive feedback and choosing positive words in our experience-based design questionnaire. A few were saying they would prefer a rota basis for a bit of variation between the assessment area and the vaccination pods in terms of health professionals moving across those different areas. How do you feel about the setup for your shift today? So that's improved from 75% the last time we measured to 93%, which is really positive, and is just testament to how hard the staff have been working, and the workforce team and the clinical education, everything that's been described so far, to make this feel like we are prepared and well set up for our shifts every day. And overall, you know, somebody said, I'm thoroughly enjoying working here with new colleagues and meeting the public every day. It's just a really joyous thing to behold. So, yeah, it makes us all feel very proud to be part of it, I think. Next slide, please. Scores on the door. So this is our target progress report. Week 10 of being open at Elland Road. And as you can see, you know, that we've really worked hard as a team to think about efficiencies and, back to that mission statement, be as effective but safe as we can be. The lead time is reduced, and patient satisfaction's gone up. Staff satisfaction, still a bit of a way to go. However, we have gone up since week 6, so that's good news. Our quality measure, though, about the number of patients that have had their vaccination without having sign-off from an assessment clinician, it was at 0 and it's gone back up to 1. So although that looks good in terms of the green, it's still a concern, because in the Leeds improvement method we aim for 0 defects. Therefore, we are focusing in on that and working to mitigate that using some improvement work over the next week. So I'm going to pass you on to Emma to tell you about our next steps. Thank you.
Next slide, please. Hi, I'm Emma Williams. I'm the lead nurse for the vaccination centres on Common from Leeds Community Healthcare. So just looking at lessons learned, obviously we're focusing on the positives as we move forward. And although we have dips when vaccine supply, etc., seems to dip out, we're still trying to keep on the positives and remind ourselves that we're all doing a great job. We do appreciate that communication is always the key, so we're very mindful of making sure, I know that Katie alluded to it earlier, our morning briefs, etc., that they're really relevant and up to date as we can do. We're also exploring new ways of working. Some of us visited the Sheffield Arena earlier this week as we're exploring moving on to more digital ways of working and becoming a paper-free centre. So we're exploring how this might look, and we're also looking at doing sort of a dry dummy run next week to see how we could move this forward. And that's one of the actual improvements that Sophie's just mentioned about reducing the risk of citizens going through without having an assessment done. Next slide, please. So some of the barriers and challenges, although it has much improved, we still do have quite a complex workforce pipelines that come in. Like I say, it has improved a lot, but we still do have some difficulties sometimes of understanding where the different pipelines are coming from and where we're at by onboarding those people and actually coming through the training pod that can then start working with us. And it's knowing which areas to identify and prioritise first. With the moving on to a digital platform, it's knowing where to start. We've as I said, we went to Sheffield just so we could actually see how it's working in a similar area to us, a similar size area to us. We've also got some involvement we had a visit a few weeks ago from the national team from NHS Digital, and they're giving us some tips of where we can start looking and how we actually start implementing this. And like I say, getting rid of the paper consent forms due to lots of issues around them about storage and potential data entry issues. So that's where we're planning to be at. Next slide, please. Okay, so the next steps are that the 5S work that Jimmy's been leading on is going to be ongoing, and also look at doing the pharmacy cupboard with the same system and the contents of that. We're actually, as I've mentioned already, we're actually going to do some test days next week. So one of these digital consent test days will actually be just with staff members playing at being role play, doing pretending to be citizens. But then obviously we will move on to citizens just to test out how that will work. The induction packs for all new starters have been updated. These now include our mission statement and also the responses, the actions that we've developed following feedback from staff. We're developing a more structured approach and support for our volunteers. So we're getting involvement. We now have St John's ambulance staff that are supporting us, and we're trying to manage those collectively with the volunteers so they all get the same support. And then there's ongoing work to improve the interpreter on wheels service, which we have in the centres. We're trying to look at creating a video to show staff how they can be used most efficiently, and also seeing how we can identify people that do have that do identified earlier on when the interpreter on wheels will be actually needed. Next slide, please. And just want to say to everybody, as usual, that we know that we're a fantastic team, but I want to say that and share that with everybody else. Thanks for everybody's support, commitment to the programme, and let's keep going as we are doing. Thank you very much.
Fantastic. That's great. Really, really good. Thank you. Thank you very much. Sophie, Sarah, Adam, Katie, Jimmy, Suzanne, Emma. Great presentation. So questions, comments for the team? Jenny.
Where are you, Julian? You sound like you're in the middle of an airport or something.
No, no, I promise you I'm not at an airport, but apologies for the sound quality.
Sorry. I thought that was superb, and it's really difficult to describe. So I just wanted to try and amplify a couple of things that the team from across the city have shared. We literally opened up across the city every single supply pipeline we could possibly do. That's what we were asked to do by our colleagues nationally. So to have been able to come together more strongly as a team to manage all of those multiple supply routes. And we did, as you say, we reached a really crucial point where training was the bottleneck for onboarding people. It's been great to see how you've used the Leeds improvement method, you've strengthened your teamwork, and you're using your PDSA to be able to unblock that bottleneck. So absolutely superb. Lovely to see the patient satisfaction score back up again. Really good to see the staff satisfaction score. Nice to know where we've still got to focus. And those patient satisfaction scores were wonderful, but it was really just again to bring it to life. So coincidentally, I was coaching a senior HR colleague who works actually for a bank, Halifax Bank, this morning, and her husband went for his vaccine just yesterday, no, at the weekend, I think she said. She wanted me to personally pass on her thanks. She said it was, he was a bit nervous. It was, the staff were so kind, friendly, supportive, but she said it was really quick, really slick, and incredibly professional. And she very specifically said to me, I do want you to pass on our thanks, because it was something he was worried about. So I thought, what a better time really than in Report Out to be able to share that with you. So well done. It's really great Report Out.
Great comments, Jenny. Absolutely, 100% agree with that. Those sentiments. Have we got any other comments or questions? Doesn't look like it. I can't see any. So can I just say a thank you again to all of you for what's been a, I think, tremendous work and progress. What's really good to see is the way in which you've brought together the education, the training, the production board, the recruitment, everything sort of is working in sync, which is terrific. Really, really excellent. So well done. That's been fantastic. Thank you very much. Do remember we've got our next report out on the 9th of April, and we're looking forward then at the next one, obviously, to seeing the output from the breast cancer team's Kaizen event. So thanks everyone for attending, and see you on the 9th. Thank you, everyone. Take care.